Pregnancy, delivery, and beyond are all very special times for you.
It's our privilege here at Kaiser Permanente's Walnut Creek Medical Center to share that time with you,
to be here for you every step of the way.
Hi, I'm Dr. Kim Probst, one of the members of our dedicated care team assembled in Walnut Creek to welcome your new baby into the world.
And I'm labor and delivery nurse Jill Meyer, also part of that team. Here in Walnut Creek, we're privileged to deliver more than 3,000 babies every year.
Which means we specialize in prenatal through postpartum care. Over 20 members of our team are midwives like me. Hi, I'm Debbie Cox. Our team of physicians, nurses, and midwives will give you an overview of what your care experience will be like.
When you find out you're pregnant, the first thing you want to do is call to schedule an intake appointment. At that visit, we'll get some basic information from you.
So Joella, when was your last menstrual period?
And then set up the first of your 10 prenatal appointments. We'll also introduce you to the 3 classes we encourage you to take, one focusing on each trimester of your pregnancy.
Early pregnancy class, there's mid-pregnancy class.
At your prenatal appointments, you'll be seen either by a nurse practitioner or by someone like me, an experienced certified nurse midwife. If you choose, midwives can be an important part of your care team, especially if you have a normal or low-risk pregnancy. It's our goal, along with our nurses and physicians, to give you the best possible outcome and to give you the birth experience you want.
Your heartbeat sounds great.
With that in mind, your prenatal care will include developing a personalized birth plan, which will include your pain control preferences. This will be a joint effort between you and your care provider.
At around mid-pregnancy, you'll be given pre-admit forms. We strongly encourage you to get those filled out and returned so they'll be in the system well before your big day arrives. It's also during the prenatal phase that we begin our conversation with you about breastfeeding.
Okay, Michelle, are you planning on breastfeeding?
Yes.
That's great.
Research shows that this is the healthiest option for your baby, so it's something we strongly encourage. We're here to support you should you choose to breastfeed, and we also offer a breastfeeding class that you can take during your pregnancy.
When the day finally arrives, first you'll want to call and speak with a labor and delivery nurse like me. I'll discuss with you the progression of your labor and help you determine if you're ready to come to the hospital. When you do arrive, you'll want to look for our stork parking signs just outside the emergency department.
Many of our members who've had a healthy pregnancy choose to be attended by a midwife. Of course, our physicians are always available as well. Either way, your labor and delivery nurse will assess you, and if you're in labor, make you comfortable in one of our birthing suites.
After your delivery, it's our goal to get you and your newborn bonding skin to skin as soon as possible. Research shows that babies are most alert in the first hour after birth and instinctively looking to nurse. To take advantage of this and let nature work its magic, most of the time we simply wipe off your baby and lay them right on your bare skin. It's warm and comfortable there. And experience tells us that skin-to-skin contact within the first few hours of life offers the best chance for successful breastfeeding.
Sometimes complications do arise, and our experienced team of specialists, like me, are immediately available to intervene. At the Walnut Creek Medical Center, we are extremely proud of our Level 3 Neonatal Intensive Care Unit, referred to as our NICU. Here, our experienced neonatologists and pediatric intensivists oversee a highly trained nursing team that will provide constant one-on-one care for your baby.
Of course, the vast majority of our deliveries are complication-free, which means you and your newborn will move together into one of our comfortable hospital rooms designed especially for you and your baby.
Mother-baby care is handled by a specialized team of nurses. A big part of their job is to ensure that you get the help you need to be successful with breastfeeding. For additional support, expert lactation consultants are available whenever needed.
Generally, our moms and babies are healthy enough to go home 24 hours after vaginal delivery and 48 to 72 hours after C-section. Before you go, you and your baby will be thoroughly examined.
Follow-up appointments are scheduled before you leave the hospital. Usually we see babies again within 48 hours of going home.
And our call center is available 24 hours a day, so questions about your own health or your baby's can be answered anytime.
Lactation support is also available after discharge, either by phone or by appointment.
The journey to parenthood is an exciting time.
For you and for us.
And our commitment to your health doesn't end after delivery.
In fact, for at least one new member, it's just the start
Of a lifelong partnership, our family and yours, together in health.